developmental sequencing from supine, sideline, prone, prone on elbows, quadruped, tall kneeling, single kneeling, standing, going into standing, and then we'll go from sitting to standing, and then eventually into a gait pattern, going over that. So the first one is supine. Okay, pretty simple here, positioning wise. Some things to think of as far as educating others, family members, the CNA, is position of the GH joint here. So what are some things we want to be careful of with this as far as positioning?
Neutral.
Yep, neutral. What's going to encourage it if his arm's way back here against the bed here? What direction is it going to encourage the humeral head to go? Anterior. So very simple. It's just placing two pillows here, getting it supported so it gets it back into that socket. You could do 2 pillows if you wanted to. Doesn't matter. What else are you seeing with the elbow joint? Flexed and curved in here. So the best you can is try to get him into a more extended position. So getting him up into this position here the best you can with it. And again, I try to externally rotate, so he's in this position here. Now, granted, I totally understand he's going to be doing this probably eventually, okay? Another way you could do it if he had a lot of tone is another pillow here, okay? Better than nothing, better than keeping him right into here. So just figure out what your patient's doing, try to get him out of that position as best you can with it, okay? And a lot of times when I'm going in working with CNA and family, that's what we're talking about, is trying to get him into a more flexed position at the shoulder, but extended at the elbow and wrist here, extended or at least open in the palm if you can. Again, he might be in this position here. Okay. Hook line position is one of my favorites as far as mobility wise. Okay, because the next transition from this position is what? What position? Sideline. So he can push with his legs here. Okay. So one of the main things we can work on to start off with is just basically, so say, let's pretend he's left hemiparesis, okay? Very common to see this leg out, not doing anything. So I'm going to get him up and position that leg here. I can support right underneath the malleoli, and my pressure is down right through his ankle. I can support here if his hip is sloppy. I can support here. But I'm keeping him in a closed chain pattern. I want him here. His leg's going to fight you tooth and nail to come out this way. So I'm holding here. And then what we can do, it's simple, but just a simple low trunk rotation. So you can go back and forth, do a low trunk rotation. You're breaking up some of that synergy if he has a synergy, just getting some mobility here. Okay. When he's trying to come back, I can use tactile cues to bring his leg to the right. So keep going, okay, here. There's other ways that you could do that. You can have him, if his leg does this out, I can have him push here, push against me, and it'll encourage that leg to come in. You can do that too. Okay, a couple different ways you can do that. But it can encourage back and forth. You can also take a ball, place a ball in there, and do that. Okay, so practice those type of things. Do a set of 20, 15 or 20 of those. Just back and forth, because what you're working on is seeing if you can go into the next segment, which is sideline, into that sideline position. Does that make sense with the low trunk rotation? Okay, Swiss ball push. I kind of like this one. You can use a bunch of different sizes for this one. So I'll place his leg up on here, support his knee. This is a hair tall for him, but it'll work. And then the other one here. And so I can support here. You can have his shoes off. But I'll support here. Now, if that's not comfortable for you, you can support here. And obviously, I want to make sure he doesn't have a hip replacement for the low trunk rotations or this. So I want to clear that out. But I can just work on bending up at the knees. So go ahead and bend back towards you. And then push against me. Push, 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 push. Back up. Ready? Push, 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 push. And so I'm using vibration to encourage extension at the knee and hip. It's very functional for sit to stand. So same thing, you could do maybe 2 sets of 15. I can use my own body weight to hold it up against there and have him push kind of make it like a game, have it kind of fun for him. Let's get you this blue ball here. I'm going to switch you on. So again, I can support here. Another thing is, remember, this side's fine. So another thing I can do is support here and here if I want to. Bend up, both legs, bend up, up, up. Now focus on the left. Push, 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 push. And so I can use cues here, and I can use tactile or vibration here to encourage him to push that way.
I've never thought of the shaking thing. That's cool.
Yeah,
Yeah,
just
have
cueing his brain. You're basically his central nervous system.
It does kind of get your attention. It's like, what's
Yeah.
going on?
Exactly. Yep.